Hi, my name is Kayla. I've been an EMT for 3 years.
My name is Malachi. I've been in EMS for a little over 10 years.
Hi, my name is Mark Itzel. I've been a paramedic for Empress EMS for 26 years.
Hi, my name is John Hill. I've been in EMS since 1990.
So when we get a call, we have to arrive on scene and we do something called a scene size up. So as we arrive, we do something called a look test. We see our patient, we assess our patient, and we assess the situation. And so depending on what we see and what we get when we get vitals and other information like that, we have to make a decision on where we need to go.
In the hospitals around here have certain capabilities. Garnett has a trauma and a cardiac cath lab. So therefore, if you're having a heart attack, we're going to take you to Garnett versus St. Anthony's, who's just going to have to transfer you out if you're having a heart attack. We're also going to take you to proper stroke centers. We're also going to know if it's a pediatric. If it's a pediatric has certain injuries, we might not even take them to the hospital ourselves. We might have to call a helicopter in and fly them to the proper hospital. They have a golden hour rule as far as trauma. If someone's having a bad trauma accident and they need surgery, we have to get them in to a trauma surgeon within an hour. The whole goal of us being here is to bring the emergency room to you and then you to the emergency room. Our ALS units have the availability of starting hearts, correcting dysrhythmias, identifying strokes, bringing to a stroke center, making sure your people are getting to the proper facilities in a timely manner.
So this is the back of our ambulance. Any patient that gets in the back of the ambulance is going to go on this stretcher. Just for safety reasons, it's honestly the most comfortable riding in this ambulance. This is our trauma bag. We like to keep everything the color of what it's really kind of be used for. So it ends up being red. There's a lot of compartments in there. A lot of everything that's in these shelves and in this ambulance are in here. This is what we call our med bag. This has a lot of the medications and fluid therapy and IVs and everything like that. This is our cardiac monitor. This is probably our most important tool. This does EKGs, monitors your oxygen, your CO2 levels, your heart rhythm. It works as an AED on top of that.
We have our shorelines that are plugged in. Our truck has to stay at a certain temperature, so we have a heat going in the back all the time, so it needs to stay charged. Toughest part of this job is sometimes just seeing people at their worst, and no matter what you're doing in your life, you have to be there for them, holding their hand and getting them where they need to be no matter what.
I think the best thing I've ever heard was from a teacher of mine was be a duck. So you're calm on the surface, but you're paddling like hell underneath.
And some of the toughest ones I've done is real serious interfacility transports with event monitors and pumps running.
So every day is memorable in EMS because I'm always meeting people. I meet people who are 102, I meet people who are 3 years old, and so I get to meet everybody. Just a couple days ago, I had a patient and we just sang the entire way to the hospital because that's what she needed.
Some of the most meaningful things in the job that I have is basically it's the end of life for someone in the family and how I can help console the family in their time of grief and to honor the wishes of the loved ones that is meeting the end of their life.
To the Chester community, I want to say thank you for supporting us. I hope that we keep serving you, and if it's not us, I know somebody else equally as caring will be there.
The one thing I would say to Chester is we'll always be there for you. It might not be me, it might not be Malachi, but it will be somebody.
One of the benefits as far as having us in the area is that the ambulance is dedicated to this area, to Chester. They don't leave this area. 100% do. We have a 9-minute criteria to get on scene.
Hi, I'm Brandon Holdridge. I'm the town supervisor of Chester, and I decided to move forward with the 24/7 contract for ambulance services with Empress EMS because I wanted to make sure my residents were safe and healthy. I wanted to protect their future. We had people waiting for ambulance services, 20, 30, 40-minute wait times with serious injuries or diseases and other situations that require them to go to the hospital, and that was unacceptable. So with this contract, we've cut down the average response time from 17.5 minutes to 9 minutes, and the average response rates from 63% up to 99%. So Chester is safer, and we are happier for it.
And the reason I keep coming back is because I love my patients. Every time I meet somebody, they take a part of me with them.